Good morning, everyone. It is Friday, December the 4th, 2020. It is currently 10:03 a.m. Central Time. I'm still here at Victory Baptist Church, coming to you live, Ovalo, Texas. You know all of that information. Thank you so much for tuning in. I greatly appreciate it. And well, we still have a lot to talk about, so let's get right to it, all right? Let's not waste any time. I continue to tell you there are three very big issues facing Christianity and Christians as we go into 2021. All right, let me go through these again. We just talked about in the last episode, one of the big issues we're going to be facing is the subject of religious liberty and challenges to religious liberty. How are Christians going to respond? How should we respond? We talked about the Human Rights Campaign putting out their blueprint, which calls for the Biden administration to possibly strip religious universities, Christian universities, of their accreditation. We talked about that. We talked about also him possibly passing the Equality Act. What could that mean for churches? I've told you all about that. That's a big issue. We're going to continue to talk about it. And as Christians and as churches and as Christian universities, Christian schools, we have to start thinking about these issues now. We need to develop a smart, wise strategy. We need to be as wise as a serpent, harmless as a dove. We need to be thoughtful. We need to be biblical. We need to make sure that we are finding facts, not lies, and we need to do our best to prepare ourselves for those possible challenges and thinking about what we can do to prepare ourselves for that. That's a big issue. A second major issue that continues to face Christians as we move into 2021 is how Christians are going to continue to respond about all of these claims in regards to voter fraud. Again, this is dominating a lot of Christian podcasts, Christian radio. The voter fraud. The evidence is overwhelming. The Trump won the election. It was stolen from him. And how long are Christians going to continue to share that narrative? And if evidence if basically the Trump administration continues to lose in court, and ultimately they cannot 100% verify their claims, do Christians stop and begin to apologize for spreading those claims? Do Christians stop and say, wait a minute, we possibly got this wrong? Or do Christians go into 2021 continuing to say the election was stolen, and continue to act like the election was stolen? How are Christians going to respond moving forward? This is a big question. And this is a big question. Look, this is not just a Christianity at large thing. This is a personal thing. This is an individual thing. Look, sometimes in your life, not just sometimes, in your life, you are going to make mistakes. You're going to say things that you find out later that was not accurate, was not true. You're going to sin in your Christian life. You're going to fall on your face. You're going to make mistakes. One of the things about Christianity is we should acknowledge when we make a mistake. We should just acknowledge, confess it, deal with it, and then, yes, get back up and move on. I don't think your failure should be fatal and that you're destroyed and that's the end of your life. Yes, you may have to deal with shame and embarrassment, but sometimes as Christians in Christianity, no matter what we do and what we say, we never really say, hey, we messed up. We just move on. I can think of all the claims Christians were making during the Obama administration that those things did not come to pass. All of the people who emailed me all of these claims argued with me when I challenged their claims, never came back and said, man, I got that wrong. I was out there spreading false information. I was bearing false witness. I committed a big sin. No. It's not even a sin. You don't even have to repent of it. So Christians have been out there just saying all kinds of things. Does it ever stop? I don't know. Do we ever repent? I don't know. And the third major area, I know I keep repeating these areas, but I want us to really think about them. The third major area going forward is going to be COVID-19. How are we going to respond to COVID-19 moving forward? Listen, how are we going to respond to the COVID-19 vaccine? Christians are already out there making all kinds of wild claims. And again, many of their claims have already been proven to be false. We listened to a Catholic bishop make claims about the COVID-19 vaccine and fetal tissue. And from all the information we can find, that is not accurate. Now, is that Catholic bishop going to come back and issue an apology for bearing false witness, for spreading lies? I doubt it. I know most other Christian podcasts, they're just going to double down and continue the theory. So here's my question to you. Now, we've talked about religious liberty today. Now we're going to focus on COVID-19. I want to ask you a very important question. 5 years from now, if people were to look back to 2020 and they were to try to write a paper for college, maybe they were going to do a doctrinal thesis, whatever the case may be, they were going to write a paper, a research paper of some kind, about Christianity's response to COVID-19 in 2020, what do you think their conclusion would be? Do you think they would look back 2020? There was this time of a pandemic. All these people were over 1 million people have died. I think we're over 270,000 people have died in the United States of America. I think as of yesterday, the numbers are staggering. We're going to get into some of the numbers. The numbers are horrible. People are dying. People are suffering, right? I wonder when they look back, they're going to say the church stepped up during a time of great worldwide suffering. The church was the place of spiritual comfort, a place of light. They were salt, they were light, they were helpful, they were godly. Or do you think they're going to look back and say what the church descended into was conspiratorial thinking, arguing and fighting about whether we should stay open or not stay open, trying to make political points, and they did very little to offer any spiritual comfort to a world that was scared and confused and people were suffering and dying? What do you think they're going to find? I call into question Christianity's response to the entire situation. I think I really thought this was going to be a great opportunity for the church, but it's really descended into, I hate to say it, it's almost become like a 3-ring circus, maybe a 5-ring circus, and there's different groups out there saying different things, and they're focused. Let me just give you a quick example. This is from Christian radio, just the other day. Christian radio, all right? Here now, again, if you look at all the news right now about everything happening within COVID-19, all the reports that are coming in, it's not good news. It's not wonderful. So what is Christian radio doing in light of all of this news about COVID-19 and human suffering and people creating the image of God dying? What are they doing? What are they talking about? Well, let's just listen just briefly to this very quick clip. Listen to this.
So that's this whole thing. You know, I got another story in here about a pathologist saying this is the biggest hoax in the history of medicine. I got to find that headline for it because I want to quote it accurately. A top pathologist claims that COVID-19 is the greatest hoax ever perpetuated on an unsuspecting public. His name is Dr. Roger Hodgkinson from the UK, or from Canada actually. He told government officials in Alberta during the current coronavirus that this coronavirus is the greatest hoax ever perpetrated on an unsuspecting public.
That's what Christian radio is doing. It's the greatest hoax perpetuated on an unsuspecting population. It's the greatest hoax in medical history. So Christian radio is out there. People are suffering and dying. And when you turn on Christian radio, you're not going to receive comfort. You're going to be told it's all a hoax. It's all a hoax. And then I'll get emails. Well, we're not saying it's a hoax. We just don't think it's as serious as they're claiming. Okay, you don't think it's as serious as you're claiming because you got your information from a video, from YouTube. Like, where did you get this? So that's how Christian radio is responding. And they're responding and they're saying things just like that while this is happening. Listen carefully. So while this is happening, that's what Christian radio was doing. Listen.
The surge of COVID infections and illness is pushing much of the country to its worst point since the pandemic began. More than 100,000 people are hospitalized. That's nearly double the highest point of the spring. The U.S. has had a total so far of 14 million cases out of 65 million around the world. That is more than any other nation on earth, and 4 million of them in the U.S. just over the past month. Deaths are also climbing. More than 2,800 were reported yesterday alone. Again, a single-day record. The death toll overall has now passed 275,000. Dr. Robert Redfield, the director of the Centers for Disease Control, warned in an appearance with the U.S. Chamber of Commerce yesterday that the winter could be even worse.
The reality is December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation, largely because of the stress that it's going to put on our healthcare system. The mortality concerns are real. And I do think, unfortunately, before we see February, we could be close to 450,000 Americans have died from this virus. But, that's not a fait accompli.
Dr. Redfield said that masks, social distancing, and other precautions by the public could help prevent the very worst projections. In an interview today on CNN, President-elect Biden said that he will call at his inauguration for everyone to wear masks during the next 100 days. The growing COVID caseload around the U.S. is putting an enormous strain on hospitals and healthcare workers. Let's hear more now from Dr. Amy Compton Phillips. She's Executive Vice President and Chief Clinical Officer of Providence. It's a healthcare system operating 51 hospitals and more than 1,000 clinics in Texas, Alaska, and 5 more states across the western U.S. Dr. Compton Phillips, thank you very much for being with us. Tell us briefly, what kind of services do you provide, and what are you seeing in your facilities?
We provide the wide range of any service you need in healthcare. We have it, everything from primary care office visits through acute care hospitalizations through rehab services afterwards. And we are seeing what the rest of the country is seeing, and that's this huge uptick in people who've acquired the infection, and then therefore, a couple weeks after they get the infection, the demand for healthcare. And so our ICUs, our hospitals are filling up rapidly with people who need acute care for this really dangerous germ.
And so do you have adequate space? How are you dealing with the space issue, first of all? Bed space?
Yeah, so the physical bed space is probably the easiest part to solve because we've been able to work on that now for 10 months. And so we've figured out, how do we flex up and down as we get more and more patients in? How do we convert leftover old storage rooms into ICUs? How do we create negative pressure rooms, right? So we can solve for the space. The thing that's much harder to solve for because of the broad base of the pandemic right now across the country is the people to operate those newly added beds. We don't have the ICU staff, the skilled nurses, the equipment, people who can manage things like ventilators and high flow oxygen to take care of all those beds that we're opening up. And that is really the hardest part about where we are today.
So where do you go for those skilled workers? Where do you find them? How do you find them?
Everything from seeing if people who've recently retired are willing to come back in, even the traveler nurses. So the folks that go around and help out where we need bump ups temporarily for new infections, right? They're all taken. We don't have those anymore. So we're turning to people who've retired. We're turning to people who previously worked outside of an ICU setting and rapidly getting them skilled and trained to work in an ICU setting. We're using telehealth services to make it so that the ICU doctors that are in short supply can cover for other doctors, for orthopedists that are covering ICU beds now with consultation using telehealth monitoring in ICUs. And so we are, by hook and by crook, really trying to rapidly scale up the human beings we need to take care of all these patients. And exactly like you said in your opening, what we're worried about is that if this continues, we're going to run out, and it is painful. As a clinician, you don't want to let people die for things that are preventable because you didn't have enough of something. This is really outside the bounds of what we're used to experiencing in the U.S.
What sort of strains is this putting on your people, the people who work for you, who take care of these patients?
enormous strains. We've had several of our own caregivers, and it's hard to even talk about, commit suicide. We've had 6 people commit suicide in the past 3 months because of the stress and the strain. Never had anything remotely like that in the past. We've just finished surveying all of our people who work with us, and the rates of burnout are going up dramatically because of the workload. Not only the workload, but because of the incredible challenges of seeing so many sick people in there that don't need to be there. We've offered services to help our own employees, everything from meditation apps all the way up through on-demand mental health care, on-demand counseling with our behavioral health concierge. And we've had over 15,000 of our employees take advantage of the services, over half of whom need tele-spiritual health, because this has been a shot to the soul. People go into healthcare because they care about other human beings, and the fact that we're seeing so much suffering right now is tearing at the people who are caring for the patients.
So hard to hear this. Dr. Compton Phillips, what do you need?
I don't even know what to say. Christian radio, it's all a hoax. It's all a hoax. It's all a hoax. And you talk to people in the medical profession, you get people committing suicide because they're so overwhelmed. The hospital system is overwhelmed. They don't know where they're going to find nurses. People's care may be delayed. This is a horrible situation, and they're doing everything they can. And some of the healthcare providers, this is an entire healthcare system saying they're trying to provide spiritual health, counseling, spiritual health for people, that they need some kind of spiritual health because it's been a shot to their soul. So the world is there like, hey, we need some spiritual help. We need spiritual help. And the church is like, you know what? Don't come to us for spiritual help for your COVID problem, because the whole thing's a hoax and you're making it up and your hospital's really empty and you're not really stressed out. It's all a fraud because you just want me to wear a mask and you want to shut down my church. That's how it works. Here's people like, I don't know what to do. I don't know how to understand all of this suffering. They're looking for spiritual health, and they're trying to create a situation where people can, do a teleconference to get spiritual health. Why would the healthcare system need to provide that? Churches should be out there saying, no, we're going to talk about suffering. We're going to talk about this. We're going to talk about pain and comfort and the reality of eternity and people creating the image of God and pain and sickness and just offering spiritual discussions in regards to these subjects. But no. No. We can't do that because we're going to be more worried about, you know what? We don't care if people get sick and go to the hospital. We're going to stay open. Our churches we're going to fight to stay open. And if that leads more people to your hospital and overwhelms you and overwhelms your system, you know what? We really don't care about you. Now, no, we would never say it that way, but is that not what we're saying? The healthcare system is like, help us. And the church is like, it's all a hoax. We're going to stay open. We don't care if we lead more people to your hospital. We don't care if we send more people to you. We don't care. We don't care. If it happens, it happens. If people die, people die. Like where are the Christians in responding to this even closely to a biblical way? Like, I don't understand. Where are Christians and Christianity's response to this? Like, Christian radio, it's a hoax. You turn the channel. Oh, this is a crisis. In fact, let's just look at some articles I have right here in front of me. Here's 2 articles just to show you. 1 American is dying of COVID-19 every 30 seconds. By Wednesday afternoon, the United States of America had set a new record for the number of patients hospitalized with COVID-19 when the number rose above 100,000 people. Over 100,000 people in this country right now are in the hospital for COVID. Well, you know what that does? That overwhelms the healthcare system. You know what that does? That stops other people who have serious health issues from being taken care of. It overwhelms the staff. It overwhelms them. What about the people caring for? Like, you can sit there and scream it's a hoax, but what about the people who I can't take it anymore. I'm doing everything I can to try to care for people, and then I got Christians yelling at me that it's a hoax. Over 100,000 people, and this has happened this is the first time we've reached that level. And by the end of the day, by the end of Wednesday, America added a new single-day fatality record. The number of people who died of COVID-19 in the United States rose above the previous record, 2,760, by Wednesday evening. Look, in fact, continue the very next article. The United States virus deaths tops 3,100 people in a single day. More people died of COVID, I think, yesterday than died in 9/11. Over 3,000 people died in a single day. This is the first time it's occurred. So Christian radio is telling you it's a hoax. Christian radio is telling you it's nothing to worry about. Christian radio is saying don't bother about it. Christians are running around yelling and fighting and arguing about don't wear a mask, and we're going to have church and we're not going to wear a mask and we're not going to social distance because we're making a point, because the Bible says forsake not the assembly. I guess the Bible doesn't say anything about loving people. I guess it's just the Bible we just rip out all of the verses about loving people and thinking about other people before you. If your healthcare system is saying help us and you're like no, then like what? Look, we have an opportunity to minister to people suffering, and we want to make points. We want to make arguments. The United States recorded over 3,100 COVID-19 deaths in a single day, obliterating the record set last spring, while the number of Americans in the hospital with the virus has eclipsed 100,000 for the first time. And guess what? According to everything that I can see, it's going to get worse. I think it's possible that we may reach 4,000 people dying a day. I think we may reach that here in the United States of America. I think that what some people are claiming, we're going to get to 400,000 deaths relatively quick. And I think January could be something that we can't even comprehend. But wait, no, actually, I take that back. No matter how bad it gets, Christians won't comprehend it because Christians will say it doesn't exist. And let me say this clearly. I'm talking to Christians. Look, if the world says people die, who cares? Survival of the fittest, evolutionary, we wipe out the weak, we help the human race move forward in its evolutionary trek. Okay, fine. The world can think that way, but that's not the way Christians are to think. We are supposed to be the ones who are pro-life, who care about people, who care about suffering, who are supposed to minister to people, who are supposed to be trying to help people who are in the darkness, who are suffering. And we just listened to a report from someone in charge of a healthcare system saying, we're trying to provide telehealth, spiritual health for people. Where's the church? Where is the church? We always talk about how during great times of crisis, it's the church that always rises up and helps people. What are we doing that in COVID? Let me see here. I think I have another audio clip here. Let me see if I can find it really quick. I think it's right here. Give me a second. I have to play this to see.
Make sure you're subscribed.
No, that's not it. Let me see if I have it here. I don't think I have it. Yes, here it is.
Tonight, the deadliest day yet since this pandemic started. New records in deaths and in new cases. 2,700 lives lost in just 24 hours. More than 100,000 Americans in the hospital fighting this virus. Tonight, news from several states coming in, including California. The governor there preparing his state for potential lockdowns, where ICUs are near capacity. The mayor of Los Angeles telling residents to, quote, cancel everything. In Ohio tonight, where they're calling for mobile morgues. The CDC director now acknowledging the U.S. was severely underprepared for this pandemic. Tonight, President-elect Joe Biden just making news, saying he has talked with Dr. Fauci and has asked him to stay on in the same role. And Biden saying he's inclined to ask Americans when he's inaugurated to wear masks for 100 days, not forever, but for 100 days to help save lives. And Biden saying he will take the vaccine along with former Presidents Obama, Clinton, and Bush. Biden says when Dr. Fauci says it's safe. Also tonight, news late today about the Pfizer vaccine. The company reportedly slashing its initial shipment projections in half because of concerns in the supply chain. So bottom line tonight, how many doses expected for Americans by the end of the year? Pfizer saying that number has not changed. And ABC News getting an inside look at a United Airlines 777, the part of the plane that will carry this vaccine. Millions of Americans struggling to make ends meet in this pandemic. There is new movement at this hour on efforts to get them help. Mary Bruce, live in Washington. President Trump showing his frustration today with Attorney General Bill Barr after Barr declared there is no evidence of widespread election fraud. The president is asked, do you have confidence in Barr? How he answers. In the middle of this pandemic, California tonight battling a second emergency outside Los Angeles. Thousands of acres burning, families forced from their homes. The major winter storm moving into the Northeast, Philadelphia, New York, Boston, Rob Marciano timing it out. And the newly released video tonight showing the moment that famous telescope crashes to the ground. Scientists mourning this loss, and you've seen the telescope yourself in the movies.
From ABC News World Headquarters in New York, this is World News Tonight with David Muir.
Good evening, and it's great to have you with us here on a Thursday night, and we witnessed one of the most difficult days yet in this pandemic. The deadliest 24 hours since this pandemic began, the highest number of new cases since this pandemic began. Tonight, California, for one, telling residents there to prepare for potential lockdowns once again, where ICUs are near capacity. And late today, President-elect Joe Biden making news, saying he has now asked Dr. Anthony Fauci to stay on in the same role in the Biden administration. And Biden saying when he's inaugurated, he'll ask Americans to wear masks for 100 days to help save lives. Tonight, more than 14 million Americans have now tested positive, more than 192,000 new cases in just the past 24 hours. And as I mentioned, more than 100,000 now fighting this virus in the hospital. Deaths now surpassing the peak last spring, at least 275,000 American lives now lost. Tonight, California's governor with that warning that there could very well be new lockdowns in areas where ICUs are close to capacity. Most businesses will shut down, including in-person dining and hair salons. Late today, Delaware's governor announcing a stay-at-home advisory and issuing a universal mask mandate. In parts of Ohio tonight, they're now asking for more mobile morgues. We have it all covered this evening, including new reporting as well on Pfizer's vaccine and concerns they had over the supply chain. So we begin here with ABC's Whit Johnson right here in New York.
Tonight, the governor of California says he is pulling the emergency brake, warning the state's 40 million residents to brace for likely lockdowns in just days.
We do not anticipate having to do this once again, but we really all need to step up. We need to meet this moment head on, and we need to do everything we can to stem the tide, to bend the curve.
A 3-week stay-at-home order triggered when ICU capacity in a region falls below 15%, many areas right on the edge. Businesses like bars, wineries, hair salons would close. Any in-person schools could stay open, along with limited retail and takeout at restaurants. As California braces for potential lockdown, President-elect Biden making news, saying he has talked to Dr. Anthony Fauci, asking him to stay on.
I asked him to stay on in the exact same role he's had for the past several presidents, and I asked him to be a chief medical advisor for me as well and be part of the COVID team.
And the president-elect saying his inclination on Inauguration Day is to ask Americans to wear a mask for 100 days to help slow the virus and save lives.
In the first day I'm inaugurated, to say I'm going to ask the public for 100 days to mask. Just 100 days to mask. Not forever, 100 days. And I think we'll see a significant reduction.
This as the nation plunges into the darkest days of the pandemic. More than 2,700 American lives lost in just 24 hours. And this stunning admission from the director of the CDC.
This nation was severely underprepared for this pandemic. And I think we have to call it the way it is.
Morgues around the country starting to run out of room. Stark County, Ohio, bringing in a refrigerated trailer as COVID deaths climb.
Over the Thanksgiving weekend, we became completely filled out here at the morgue.
And hospitals bursting at the seams. At least 100,000 people now hospitalized with COVID, a new record.
That's because of this virus, okay?
If my beds are full of COVID patients, I can't deal with those patients that need me when they come in with acute heart failure. We don't have staffing for us, so therefore we don't have beds.
The CDC extending its travel warning through the end of the year, pleading with people to stay home. As cases surge, the holiday season rush on testing continues. This drive-through testing site in Norwalk, Connecticut, many of the cars here lined up hours before the gates even open. Now you're seeing the numbers tick up again, correct?
Absolutely. The numbers are going back up, and we know that that's because people were exposed, and they're finding out through contact tracing that they might be at risk.
In Oklahoma, ICU nurse Lizanne Jennings lost her mother and husband to the virus within 3 days of each other.
I'm an ICU nurse and I help all these people, and I couldn't save my own family.
Lizanne laying with her husband Dennis in his final moments.
I'm going to let you go now, okay? And he said, uh-huh. And I said, you're going to be in peace.
We have to remember these families every night here, and Whit joins us live.
I mean, how can Christian radio be screaming it's a hoax and then you turn the channel and and I know everybody's like, it's all fake news, it's all fake news, it's all fake news. Like that's what Christianity is going to be known for. During a time of great crisis, Christians turn to, it's fake, it's a hoax, it's not that serious. We need to stay open. We're not going to wear a mask. We're not going to social distance. We're not going to listen to your pleas for help. We're not going to do anything you ask because we're going to do what we want, and we don't care about anyone else. And I have reached a point that I am fed up with Christianity being this way. Because I thought we're supposed to about loving people. I thought that that's what it's supposed to be about. Like, just stop claiming we're pro-life. Stop claiming we love anyone. We love our stinking selves. That's what we love. And we don't want to sacrifice one thing for the possible good of other people. We don't want to do one thing that could put us out to possibly help or save other people. We don't want to do anything to help the people in hospitals who are overwhelmed. We don't want to do anything. We have the technology available to do all the teaching we want. We have the ability to go live 24 hours a day, 7 days a week. I am a church with no money in the middle of nowhere. And just this year, in 2020, I have now done well over, I think I'm close to 900 podcast episodes in less than a year. From January 1st to December 4th, I have done over 900 podcast episodes. Now, you could say 887 of them stunk and maybe you had one good one. You could be right. Okay, I'm not going to claim of the quality of them. Maybe you may say you should focus on the quality over the quantity. Maybe so. Maybe I realize that the quality will never be good, so I try to overcome the poor quality with the quantity. But the point is if I can do that, okay, and I'm just one person with a laptop and a microphone. I have no producer, no staff, no writers, no researchers. Well, you, the listeners, are my researchers. And I do the best I can to talk about these things, to try to provide. I try to get everyone reading The Imitation of Christ by Thomas A. Kempis. I've tried to get people to. I've tried to create Bible study exercises. I've tried to do everything I can to try to get people to be spiritually focused, and I'm able to do that without putting anyone at risk. And not just maintaining the teaching of the church, I've exceeded any expectation for the amount of teaching I've put out. I mean, 900 episodes in less than a year? Now, there's churches that have an entire staff of people. They could be putting teaching around the clock. But what are we doing? Look, where are these big churches offering a comfort and counsel to hospital staff? Look, where's the church? Where's Christian radio? I really thought it was going to take on a whole different dynamic. Maybe I was naive, but I really thought, okay, man, this is a bad situation. Well, we're getting ready to live through a pandemic of epic proportion. Okay, the church is really going to respond in a very, and I'm not, when I say, look, I always know there's exceptions. Trust me. Look, I'm not saying all churches. I always have to clarify that because some people email me, well, not every church. Well, obviously, I don't mean every single church, all right? I'm saying Christianity at large, Christianity in general has acted so foolishly during this. It's like we're trying to make a point. We want to make a point. We want to argue. We want to, all of a sudden now the only verse in the Bible that matters is forsake not the assembly. Where in 2019 and 2020, churches forsook the assembly for all kinds of things. cancel services for this, cancel services for this, cancel. Oh, we're going to have fun, food, and fellowship. We're not going to have a church service tonight. Oh, we're going to get rid of our Wednesday service. Hey, it's the summer schedule. Let's cancel Wednesday services and Sunday night services, and we'll just go to Sunday morning service, and then we'll go back in the fall. We alter the church services for anything and everything, but a pandemic where your medical community is like, please help us. Nope. You got a doctor saying, hey, if someone comes in with double heart failure, we can't take care of them because we don't have the ICU space. What? Okay, then what can I do? What can I do? Local hospital, what can I do? Well, you can do everything you can to ensure that your church is not to spreading it. Okay, well, you know what? I can do what I can. And then you got Christians who are like, you know what? You're going to make me wear a mask. I'm not going to go to church. Well, how godly of you. You should get a celebration for your godliness. But you know what? Hey, we don't have to love people. We don't have to care about people. That's not a sin. That's not a sin. No, we've only got certain sins that we care about, right? You're a pastor, you put people's lives at risk because of COVID-19. Who cares? Who cares? You're godly. You're a godly person. Oh, you did that? Oh, now you got to be destroyed. Now you got to be destroyed. Putting people's lives at risk, no big deal, because you're showing your godliness. I mean, how during this pandemic, how many times have we said church was open, people got sick? I've got articles. In fact, maybe let me look at my notes really quick. Maybe I saved it. Some big mega church, they reopened, started doing in-person services, and now one of the pastors died of COVID. Genius, Let me see here. Yeah, I don't know. I don't think I have it here, but yeah, it was a big church. They reopened and now the pastor got COVID and he died. Yeah. Okay. Yeah, and I got some other things talking about other things Christians are doing during the pandemic. Now, there are churches out there that are doing their best. They're striving. They're trying to help people. They're trying to minister to people. They're doing what they can. I mean, churches right now, we need to be focused on helping people who have financial needs if you can. I'm a small church. So far, as far as I know, no one in our church is having any major financial issues. But if someone in our church was, that's what we need to focus on. If we had more money, if there's people in the community who've lost their job, like that's what churches need to do. Focus on the people around you who've lost their jobs because of COVID-19. Who do you know in the healthcare world? What can you do to offer support to the healthcare workers? If you have look, small churches, we're sometimes limited in what we can do. That's what sometimes I hate. It's the big churches. If you're a big church and there's a hospital near you, what can you do to offer some kind of support to those healthcare workers? What can you do? Can you be there to provide food for them? What can you do? How can you help them? What do they need? Find out from the hospital administration. What can we do? What do you need? What can we do to help you? But it doesn't look like the church is the place of support and care and love. It's a place of denial and playing it all down. And I don't know, like, no matter how many reports, I mean, I already know what's going to happen. Before I even get home, I'm going to have emails in my inbox saying, it's all a lie. It's not that serious. You're making more out of it. You're buying into the false narrative. You're buying into the New World Order trying to control you. You're not saved. You're a loser. And that's what I'm going to get. Because I dare say, hey, there's people suffering and dying. There's people, it can't be that bad. It can't be that bad. More people die of this. Okay, whatever other people are dying of every year, this is on top of that. And I know that there's the report that came out that said deaths haven't increased. I've heard that report on Christian radio, but it's also been fact-checked by a number of places, which calling it all into question and saying that data was incorrect. So don't send me that. I've had that article sent to me 100 times. It's already been fact-checked by a number of people. I've got all the fact checks right here. So once again, Christians spreading false information. But hey, that's what Christians do, right? We lie, we bear false witness, and when people are dying, we just say it's a hoax because we really don't care while we all yell and scream about abortion is evil, abortion is evil. Yeah, abortion is evil. But what do we not, does that not matter? Do we only care about the life in the womb, but we don't care about the life out of the womb? Yeah, you can tell that I'm irritated and mad because I'm just so tired of hearing Christian radio telling me it's a hoax. Look, I understand that we want to protect our religious liberty. I understand that. I want to protect our religious liberty. I understand it. I've said it from the very beginning. I don't like the government telling churches what to do. I don't like that. Trust me, I don't like that. I don't want the government doing that. I don't want the government messing with any religion. I want all religions to have freedom and liberty. I do. And so I've tried to always frame this discussion isn't about the government. It's about the church saying, in the middle of a pandemic, what would Christ have us to do? What is a biblical strategy moving forward where we still are teaching people, equipping people, still preaching, and at the same time trying to protect people's health? When we have a service, how can we have a service that's safe? When can we do it? Small churches are a lot easier to work that out. But can we not take an extra step and people do what they can? Look, I'm thankful that I have a church where someone who I had a person call me and say, hey, look, I'm a first responder. 80% of our calls right now are COVID related. I don't think even if you have an in-person service, I can't come back right now. I think I would put people at risk. You know what? That's godly. That's thinking of other people, not himself. That's what we need is thinking about other people. What can we do? Now, if you believe, and it's a part, like you believe that scripturally you have to have an in-person service, then why can't you do everything in your power? It always goes something like this. We are not going to close. And then typically someone will say, because of the so-called COVID situation, which means they call it into question that it's even real. And then when you go look at their in-person services, you see that they believe that it all starts with them believing the COVID situation is not real. That's almost where it always starts. Even MacArthur started his whole thing with, there is no pandemic. Okay. So now, and then he has in-person services, and guess what? No social distancing and no one forced to wear a mask. Why? Because he doesn't believe the pandemic is real. Like, it would be, I would love to see a church that says, look, people are out there dying and we are horrified at that. And we're going to do everything we can to help people, but we believe scripturally we have to have an in-person service. However, we're going to show you that we believe the situation is real by taking every precaution possible. And we're going to be creative in how we do this. We're going to have mask wearing, social distancing. We're going to limit the number of people who can attend one service, but we're going to expand the availability of services throughout the week. Right? Monday, like in-person service, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. And we're going to limit the number of people who can attend. We're going to do a service each morning. We're going to do a service each afternoon and a service each evening. Do 3 a day. Spread it out. That's where all the people of your church can attend a service and they have all kinds of options available to them. Now, small churches can't quite pull that all off. But again, small churches don't have to have multiple services to get everyone in. You maybe only have to have 1 or 2. But I just think that our whole response to this has just been, I just don't get it. I just don't understand. It's like, is our priority people or is our priority ideology? What do we value most? People, life, or making a point? Making a point. I thought the whole thing was a hoax just to get Trump not elected. Well, now that seems to be pretty much over and all of Trump's legal battles are coming to a conclusion and he keeps losing. Everyone told me, Christians told me that the pandemic would just magically disappear. After the election, it would just magically disappear because it was all just a hoax. It continues and it's getting worse. The election is over. The election is over, so why don't they just call off the hoax? Oh, now it's because they want to shut down churches. Now they're because they're trying to persecute us. Well, they're also shutting down, I don't know, movie theaters, bars. And again, I will continue to say this. I'm a professional wrestling fan. And every time I turn on professional wrestling and there's no one in the audience, not only is it so shocking because wrestling storytelling really demands the audience reaction to kind of determine how the story goes. But that's I won't get into all of that. It's like last night I was watching basketball and I was like, there's no one in this. There's no one there. And it's shocking. Well, if sports teams, concerts, wrestling, all of these other things have been impacted, it's not just the church. Now, I agree. There are some cities. Listen, and I'm trying to look at this from every perspective because I just don't want to have to deal with all the emails. Look, I understand there's sometimes a city or a county or a state where they issue some rules that seem a little bit like, wait a minute, you're shutting down churches, but you're letting a strip club stay open? Wait, come on now, right? You're shutting down the church, but wait, you're letting the bar stay, like in some states, you're kind of like, that's a little iffy. And guess what? When it's a little iffy, the church should take every legal recourse to fight it in the courts. At the same time, trying to demonstrate that what we care more about is not winning a legal battle, but what we care more about is the spiritual condition of human beings and people's lives and ministering to people who are suffering, and that we love people and we love even our enemies. You can have the legal battle, but make it clear that what you care more about is something more than a legal victory. What you care more about is other than just making a point and trying to act like you're all, coming across like you're arrogant and like, ooh, we're going to make a point. We have faith over fear. We're just like you're like a kid on the playground trying to make a point. How about come across that, oh, we're a church and we care about human beings because created in the image of God. And when people die and suffer, that we care and we're going to do what we can. And we're not going to do anything to contribute to the problem. And we're going to do everything we can to alleviate. And that we're going to try to provide all that spiritual health that people want and need. All right, I'll stop right there. Yeah, because you can tell I'm very frustrated. So we've got three issues facing the church. We got religious liberty issues, dealing with the Human Rights Campaign and their blueprint. You can read that blueprint on the theologycentral.net, what they're calling for. You need to understand that. And the Equality Act is coming. The Equality Act is going to be passed. There's no question about that. I think the Equality Act will be passed probably before February or in February. I don't know what that's going to mean. Right now I don't have all the information in front of me, so I'm going to say I don't know what it means. I know I've talked about it before, but I don't want to. I don't have the information here in front of me, so I don't want to anyway try to rely on memory and then get something wrong. Okay, so we need to be prepared for that. We've got the whole COVID-19 situation, and how has the church responded? How will we respond moving forward, especially as it comes to the vaccine? Christians don't seem to want an option. They don't want a social distance. They don't want to limit the size of gatherings. They don't want to wear a mask, and they don't want the vaccine. I guess they just want people to die because they've not offered me a better solution other than it's all a hoax. It's not real. All right. So, okay, you go tell. It's the same thing when a mass shooting happens and you get Christians saying it's a false flag. It's not real. People didn't really die. Okay, well, you continue to pretend people don't die. All right. That's crazy, all right? And so we've got the election situation, the election result situation, and Christians continuing to fight that battle. I had the audio. I'm not going to play it right now, but of Christian podcasts just continuing with, it's all a hoax, it's all a hoax. That's all they can talk about. It's all they can talk about. It's like the church has become a conspiracy riddled, just inept mess that's seeming unable to see anything from a spiritual perspective and unwilling to care about people who are suffering and dying. And at some point, the church is going to have to repent, and we all have things to repent of, and we need to look at ourselves right now. This should be a time for self-examination and repentance. That's what the church needs. All right, I'll stop right there. You can email me all of your disagreements to newsif. I should just give you a fake email address, but I won't. newsif@yahoo.com, newsif@yahoo.com. Go ahead. Tell me I'm an idiot. Tell me I'm probably going to go to hell and that I don't have the Holy Spirit because, I care about people. That's there we go. All right, everyone have a great day. I'll probably be back on the air here shortly. God bless.